Hi, I'm Nicole from Physiotherapy, and today we're going to be doing hip stretches. Just a quick reminder to consult with your physiotherapist before performing any of them. So the first stretch can be performed while lying in a bed or on the floor with a mat, making sure that your back is nice and protected the entire time. You're going to slowly start to lower down with your back placed against the ground, and you're going to keep one leg bent and straighten out the other leg, and you're going to use both of your hands to apply support to your knee and slowly pull your leg towards your chest. Once the stretch is felt in the back of your legs, so in your hamstrings, you're going to hold it for however long the physiotherapist has prescribed you. For the next stretch, you're going to be performing it while sitting in a chair, making sure that your back is nice and straight. You can place your hands on your lower back to make sure that you are maintaining a straight back the entire time instead of slouching it. We make sure that that you use straight back the entire time because it takes the stretch out of the back and putting all the focus in your hamstrings. So you're slowly going to straighten your leg out, placing your heel on the ground in front of you. And if possible, make sure that your knee is nice and straight. You're then going to bring your toes towards you by flexing your foot. And then if you need an extra stretch, you can slowly start to bend forward, again, making sure that your back is straight the entire time. Once a gentle stretch is felt in your hamstrings, you can hold it for however long the physiotherapist has prescribed you. You're then going to return back to neutral position and perform this stretch on the other leg. If needed, you can use a bed and make sure that your legs are hanging off the bed the entire time. And again, you can perform the exact same movements. So straighten out your leg in front of you, bend your toes so that they're facing towards you, and you're going to slowly start to lean your body forward in a nice straight posture. The third stretch can be performed while lying in a bed or on the floor using a mat to protect your back. You're then going to lie on your back with your knees bent, and you're going to cross your one leg over your other, placing your ankle on your knee. You're going to use your opposite hand to reach and grab the outside of your knee that is crossed over. And you slowly start to pull your leg towards the opposite side. While doing the pull, you're going to rotate your body so that you're keeping your hips flat the entire time. Once the stretch is felt in your glute, you're going to hold it for however long the physiotherapist has prescribed you. The fourth stretch is similar to the other stretch in that you're going to be lying on a bed or on the ground with a mat. You're going to straighten your one leg and keep your other leg bent. You're going to place your hands above on the opposite side of your knee, and you're slowly going to start to pull your knee and your leg towards the opposite shoulder. While pulling with your hand, you're going to try to maintain that your hips are on the ground the entire time. The goal of this stretch is to feel it in your glute muscles, so in around here. Once that's felt, you're going to hold it for however long the physiotherapist has prescribed you. For this stretch, you're going to start off by sitting in a chair with nice straight posture. You're going to cross your leg over and place your ankle on your opposite knee, making sure that it's a figure 4 position. You're going to slowly start to press your knee down towards the floor until a stretch is felt in your glute. In order to obtain a more greater stretch in your glute muscle, you can slowly start to lean forward, making sure that you have straight posture the entire time. Once that stretch is felt, you can hold it for however long the physiotherapist has prescribed you. For the sixth stretch, you're going to start off by sitting on the edge of your bed. You're slowly going to start to lean back on your bed with your back flat, and you're going to bring your knee towards your chest, making sure that the other leg is dangling off your bed. You're going to try to obtain a stretch in your hip, like in around here, and you're going to hold it for however long the physiotherapist has prescribed you. If this stretch is not felt, you can move again a little bit more on the edge of the bed to make sure that you're getting that nice stretch in your leg. And the leg that is straight, just keep it relaxed the entire time. Again, once the stretch is felt, you can hold it for however long the physiotherapist has prescribed you. For the last stretch, you're going to perform it while sitting in a chair. While I'm using this chair, I recommend using a chair that has no armrests so that you can completely sit flat in a chair and sit on the edge instead of like so. But for this, you're going to make sure that the one leg that is towards the chair is bent, and you're going to slowly start to bring your other leg back towards you making sure that you feel a stretch in your hip. Once that stretch is felt, you can hold it for however long the physiotherapist has prescribed you. Just a quick reminder, while doing it, make sure that you have straight posture the entire time.